He's a boxer beagle pit bull mix.
Wow, that's quite a mix. I'd like you to meet my friend Joanne. Yeah. She receives in-home health care. And you told me before that it's particularly difficult to have someone else take care of you, or at least it was, especially in the beginning.
Yes.
And why
because
is that?
I was always a caregiver myself. I was 10 years old the first time I did CPR on my father, and then I worked in the nursing home as I got older, taking care of other people. So,
wow.
Old sick people are all I've ever been around.
Joanne worked for 25 years in nursing homes. She cared for people in her same situation. She can't care for herself now, and she needs assistance from a nurse. You used to dance, right?
Oh, yeah.
So tell us about that. I wonder, what did you used to do?
I used to do all kinds of dancing, you know. I worked for, or I danced on the American Bandstand.
Wow.
And I used to be one of those girls that was in the cage, you know.
Really?
Yeah.
On American Bandstand, or where?
Yeah. Yeah. Not so much on the show, but like when American Bandstand came to Lansing, and they would have to-dos,
right.
you know.
So there's some people that are critical, for example, of nursing homes and also home care. They don't like the government spending money on it because it's our tax money and that kind of thing.
I think it's crap because of the simple reason is nobody knows where they're going to be before they die. And if you'd asked me 25 years ago if I was going to be in the situation that I'm in right now, I'd say no. Well, guess what? Here I am. So you have to remember to do what you would do or you'd want done if it was being done for you. The president stopped and thought, you know, before he made a ruling that he'd be having to live under that ruling also, then he'd give it a second thought.
In-home health care saves taxpayers tens of thousands of dollars for every person that is not forced into a nursing home. Often living at home provides a better quality of life. Why shouldn't Joanne's kids take care of her? Why should I pay for it with my taxes?
I mean, they can't be expected to take their life and put it to my use any more than I would have expected to have to put my life to take care of my parents. I mean, even though I did take care of my parents, you know, if I'd had a different job or a different husband and lived in a different state, they couldn't have expected me to necessarily move back to give them the care that they needed to have.
Yeah, what if they have family in 2 different cities, for example? Then the husband would have to go take care of his parents and the wife would have to go take care of hers.
Right.
That could break up a family, right?
That's right.
So,
and not only that, 9 chances out of 10, most parents, the kids couldn't do the job they wanted done anyway. You know.
And sometimes you need professional care, right? So, how would you like to be treated if you had MS? How many people don't have kids or a spouse that can care or even that will care for them? So, how long has it been since you've been able to walk? Do you remember what year that was? Because I know you were using a chair and walking for a while, right? When you
well,
felt
I still
stronger.
walk once in a while with a walker or whatever, you know, but it's probably been, I'd say 6 years.
6 years or so. Okay. Despite her condition, Joanne always seems to be smiling when I visit. She tells me that life is short and it's better to live with a good attitude. Since this interview, Joanne has been forced to go into the nursing home because she needed such intense care. However, she is receiving therapy and does hope to make it home.